is Cheska.
Yeah.
And this one's Delphi. Twin 1, twin 2.
Wow.
Is how you probably remember them.
Oh
no, A and B or something.
I remember them when they're about this.
Yeah.
How big you were when I first saw you? Has your mum shown you? Yeah.
How big were you?
How big do you think you were?
How big were you?
Yeah,
it's like the fish story, you know, like,
exactly.
I caught a fish this big, but when you have a prem, it's like, they were like, I swear, this big. How many babies do you think a year are born prem that you deliver?
That I deliver personally?
Like, maybe under like 32 weeks.
Yeah, really minimal number.
Minimal?
Yeah, I'll probably count on 2 hands, I think, in terms of under 32 weeks. I usually count on 2 hands, I think. Not very many, so you guys were a special group.
Oh, yeah, okay. Yeah, I suppose, like, definitely, well, statistically low, I suppose. Of those, are they often multiples? Or? Yeah,
I think certainly multiple pregnancies would be a much higher rate of being delivered before 32 weeks.
Yeah.
So, I think, you know, overall prematurity rates, you know, most people quote sort of approximately 8% less than 37 weeks and probably 3 or 4% under 32, but that'd be higher for twins and things like that.
Yeah. So. And what's the earliest that you have delivered?
The earliest would be 23 weeks.
23 weeks.
I think, yeah, so just on the cusp of viability of where babies are actually able to survive.
And survived?
Yeah.
Oh,
yeah.
Wow. Yeah. Incredible.
So it's just it is pretty amazing how all the developments, etc., that are occurring at the moment, that babies are surviving and surviving well at, you know, sort of earlier gestations. I think there is going to be, and there is a natural sort of cut-off below which is going to be very hard to support babies. But even in the context of when I first started training to now, I think the ideas of how well babies will do and what outlook there might be for them at, you know, first it was 25 weeks and then 24 weeks and now 23 weeks is improving all the time.
The rate at which babies are born stillborn hasn't like declined in the last 10 years. Do you think though that you've seen much technology, or like why is it that we aren't seeing any improvement with that rate?
Really
but then
because there certainly are babies being born at a much earlier gestation, and so you wonder how many more of those babies are being born that have been given a chance that aren't surviving. Compared to what is traditionally, the traditional statistics and what's been looked at in the past, trying to work out whether you're sort of comparing apples with apples in that sense. So it seems almost unbelievable that there have been no advances in reducing the rate of stillbirth over the last 10 years or so.
Yeah,
and which groups I think are you looking at? I think certainly there's a lot of work at the hospital now looking at the big group, which is the term stillbirths rather than the premature sort of stillbirths, looking at how we can possibly reduce the term stillbirth rates, looking at different ways of trying to pick up when a baby's placenta is not working that well, and outside of what we've traditionally used up until this point, which has just been trying to find the very small babies. We know that there are some babies that don't fit that classical definition of being very small, but albeit still don't have a placenta that works very well. And certainly those babies are at risk of stillbirth, and looking at different ways of being able to identify them and then deliver them, hopefully before something tragic happens. So I think there is, it is the number 2 questions, and I guess that's what PremJam's all about in terms of how do we reduce the number of babies that are born prematurely, and how do we reduce the number of babies that are stillborn. Is sort of the holy grail in obstetrics, I think, at the moment. So when
I was pregnant with the girls, who were looking extraordinarily moved by all of this, I felt pain and then came in and had a week in hospital first, and I had all the steroids and things. Do you have any advice to mothers that be looking out for, you know, because I know that week was crucial, wasn't it? Like the steroid week.
Exactly right, and so the steroid week and even a day or 2 days, getting enough time to have steroids sort of given before the babies are born is absolutely crucial. I guess even the magnesium that I think these girls had the benefit of, that was a relatively new thing when they were born. So there's changes all the time, but it's so hard for women who are pregnant because they, aches and pains in pregnancy come with the process, and it's pretty uncomfortable. But certainly anything that feels like a period pain, anything that feels like it's a coming and going pain and lasting for a reasonable amount of time, 30 minutes to an hour or so, and isn't abating, especially if it's keeping you awake at night, it's at least worth giving the hospital a call and finding out whether it's something that needs to be checked out or whether it's something that might be sort of related to ligaments and joints. But usually that in that sort of context, it's usually not usually the uterus, and usually need to be seen in that sort of situation.
Because I know that sometimes women sort of think, oh, and Australian women particularly, it's like that toughen up sort of attitude, get over it, this is like what pregnancy is about, and maybe we need to actually just like listen to our bodies more.
Yeah, definitely. And as I say, I think it's important to try and work out, and again, it's not always, it shouldn't be the responsibility of the particular woman themselves, but there'll be some aches and pains in pregnancy that are to be expected, and not so much that you need to just suck it up and get on with it. There are some things which are going to be uncomfortable, and there are going to be pains which might be indicative that something abnormal is happening. And a lot of women also fall into the trap of thinking, oh, this can't be labour, I'm only 27 weeks, so it can't be labour, it must be my back or something else going on, where, you know, in actual fact it can be. And they sort of brush it off and try not to ignore it. And the thing I hate the most is women who don't want to annoy their health providers and think they're being a nuisance by calling and asking for advice.
Right.
So it is never an issue and always appropriate.
I think my saving grace personally was that I had already had a baby previously to having the twins, Prem. So I knew that the aches and pains weren't normal or weren't like the first time, so that's sort of why I asked. But then people that are having their first pregnancies, it must be a lot harder to realise what's normal.
Exactly, not knowing what's normal and thinking that they should be expected to understand what's normal because they're a woman, they're pregnant, they should know what's right, what's wrong, is not, pretty unfair on women, I think. So, my advice would be always call if you're unsure, but specifically those sort of pains that are coming and going and lasting for a reasonable amount of duration, especially if it's associated with a change in discharge or bleeding, you definitely need to be in touch with them for advice.
And one final thing, I know that I personally have had a lot of guilt associated with having preemie babies. I thought, I shouldn't have walked so much, I shouldn't have eaten that thing, and you just like pick apart everything that you did. And really, looking back on it, I didn't do anything differently than my first pregnancy, which was full term, but it just is the way it was. Do you have any words for, I suppose, mothers that have had preemie babies and the guilt associated with having preemie babies?
Look, I think that's a really common reaction, and it's something I personally spend a lot of time with those women, trying to absolve a lot of that guilt and trying to reassure them that this has got absolutely nothing to do with what they've done. And as you say, you'll try and find anything, whether it's something you've eaten, whether it's how long you stood for, having intercourse is another common misconception, etc. But as you say, it's often nothing to do with what the woman has or hasn't done that's caused them to deliver prematurely. So I can only sort of echo your sentiments in terms of saying, look, it's a natural reaction, but I hope that a lot of these women are getting reassurance and advice that it's often nothing to do with what they've done or anything they could have done to prevent it or may have done that have made sort of caused it in the first place.
Yeah, awesome. And was I the hardest patient you've ever had?
Hardly. As I said, only good memories about you four.
Oh, goodness.
5. Malachi's not here at the moment.
I know. Malachi tearing apart your office every time.
I can tell you, that's my mum on my shoulder saying, this is karma. But I do remember how small they were, and I think you never quite forget how delicate and how fragile they are when they're that young and that small.
Yes.
Have you guys got training wheels on your bikes? Yeah?
Yes.
That's okay.
They might come off by the end of the trip.
Yeah, exactly. They may not need them anymore. What colour is your bike? Purple. And your bike? Pink?
Yeah.
I'm trying to remember who someone was a little bit bigger.
Do you know the weirdest part? Is that Cheska was 200 grams smaller. To this day is 200 grams smaller. So same.
No.